Good morning, everyone. My name is Melissa Jones, and I'm the Executive Director of BARHII. And I'm thrilled to have you here today on what I feel like is one of the most pressing issues that we're facing in a moment full of pressing issues. So it's a personal one for me. So I think essential workers are such an important part, and safe workplaces are such an important part um, of quality of life and of housing. I grew up in a family and I grew up in a union family and with a dad who really worked with and tried to make sure that people were being treated fairly in Boston in a time when that was really a hard thing to do. And my brother, worked his whole adult life in construction in a way that was really hard and where safety is so important. Um, and, um, for at the start of the pandemic, as shelter in place went into place, my partner continued to work. He's a mechanic who works on big rigs and continued to work. And at the beginning of that process, you could see the relief around continuing to be earning money and earning hours in this really complicated moment. And I could feel the shift when it became clearer to people that they were feeling less safe at work, where it was, you might remember when shelter at place first came into place, people weren't being asked to wear masks in general. And so when the masking order came, there was this sense, and I think a lot of the guys he worked with were all saying, well, wait, how safe was it for us to be out there? And, I think that shift you could feel, the change between, great, I'm still working, and now I'm still working and I'm concerned. And it's something that I had felt before during the fires 2 years ago, because he works, out on a pad, out on a sort of concrete area out in front of where they do a lot of the work on the trucks. And the weather, you probably remember, and the air had been so dark and so thick about 2 years ago when the big fires were burning, even though we were way over in Oakland. And I was really concerned because there was no guidance provided to them about what to do at work. And so I have been thinking about working on and talking to in my own personal life a lot of folks around workplace safety and watching both the emotional toll and very concerned about the health toll that takes. And so at BARHII, we've been trying to think about how to be in support of health departments who are thinking about so much right now, and in a place of trying to figure out how to support essential workers to understand what's going to be safest for them in this moment, and trying to understand how to support business to know that. And then for industries where there hasn't been a history of worker protections, a sort of capacity around expanding and making sure workers are protected, to make sure that a strategy around enforcement. And so we contracted with a gentleman who's here today, Bradley. I don't know if you can wave, who's got a union background and has worked across a variety of industries to help us think about what are the mechanisms for worker safety right now. And he's done a great assessment, talked to a lot of people in public health and a lot of other folks about what can be done. And so he's going to share a bit of that assessment now. We're going to hear from Karen, who's the health officer and public health director in Napa County, who has been doing work on issues of essential workers and really try to dig into what we can get done. I want to thank you all for being here because I know so many of you are essential workers. And I know that you feel both the incredible press to do work for community right now and the incredible stress that is not just the stress of COVID-19, which is so big, but the stress of having been activated across multiple crises right now and across the last number of years where we've seen this increase in fires. And so particularly for folks from the North Bay in Solano County and Contra Costa, we want to really thank you for the level of work that you've been doing year on year with the fires and the power shutoffs and now with COVID. And so if folks can give everyone a hand for all that they've been putting in on this work, it would be great. Thank you. So I'm going to take a moment and move us now into the next part of our agenda, which is to open up a little bit who the partners are that you're going to hear from today. And so Will, can I get you to do a little bit of that overview?
Yeah, for sure. So I'm Will Dominy. I am the Impact Manager for Housing and Equitable Development at BARHII. And then in my past job in San Mateo County, also did work around worker protections, which is has been a little piece of my work here at BARHII as well in the last little bit. And so today we're going to hear from Laura Stock, who's at UC Berkeley Labor and Occupational Health Program, and Laura's been really helpful in in thinking about the landscape of worker protections and enforcement. And so she's going to give us kind of a lay of the land. Then Karen, as Melissa mentioned, is going to give us a little bit more of like, what's the view from Napa, and what's the view from a health department, from a health officer. And then we're going to move into, well, me, I'll be sharing some of the results of the work that Bradley has been really like doing a lot of the lead for in terms of talking with worker organizations. And I've been in touch with a number of our health departments. And we're going to share a little bit of some of the preliminary strategies that we're hearing. And the goal today is really to think together about which of the strategies, what are we hearing today that we think could really be applicable, and how do we actually start moving into practice and making sure that workers get the protections that they need and deserve to stay healthy. So that is it. And I think with that, I will turn it over to Laura to take us through the landscape of worker protections, and unfortunately also the lack thereof. Take it away, Laura.
Thank you. So I'm waiting for my slides to appear, but I just see a blank screen. I think I saw them a moment ago. But while I'm waiting for the slides to come up, I can just start by telling you a little bit about LOHP. LOHP is a program at UC Berkeley, and our mission is to build the capacity of workers and work organizations and others to advocate for improved working conditions. And our work includes participatory worker training, development of educational materials in different formats and language and literacy levels, participatory research, and adding a public health lens to policy analysis. We're part of the School of Public Health at Berkeley, at UC Berkeley. And during the pandemic, LOHP has been providing training, webinars, technical assistance, policy consultation to workers, employers, and others. And we've also conducted some research on the impact of the pandemic on essential workers. So thank you so much for inviting me to be here. Next slide, please. So I just wanted to briefly acknowledge the fact that the pandemic has revealed and exacerbated social and racial inequities, as well as fundamental gaps and challenges in the system set up to protect workers on the job. And we've all seen the disproportionate impact that COVID is having on specific demographics of essential workers who have not had the privilege to work at home. And we all know that many outbreaks have occurred in low-wage industries where frontline workers are largely workers of color, in such industries as food manufacturing and distribution, warehouses, retail, manufacturing, home care, transit, and agriculture. Next slide, please. So I know a lot of this is familiar to many of you, but just to set the stage, I thought I would just very, very briefly share what the key provisions that we're hoping that employers would introduce to ensure that workers are protected from COVID-19. And so just to go over them very briefly, obviously the first is to encourage workers to stay home if they have symptoms or are sick or exposed. And of course, in order to make this happen, people need to have sufficient paid leave. We also want to be ensuring that things are rearranged in the workplace so that there's physical distancing, so the workers and the public can stay at least 6 feet apart. We also want to ensure that there's sufficient ventilation, and this is more important than ever as more evidence has come up about the fact that COVID is airborne in the workplace. We also need to have effective and appropriate PPE, and that is appropriate to the specific hazards. Obviously, healthcare workers need N95s, as do others who are going to be in close contact with people who are potentially sick. We also want to ensure that surfaces are clean and disinfected, and there needs to be specific protection for cleaning staff, because we're hearing that cleaning staff is being asked to use a lot more harsh disinfecting chemicals, and so we want to be sure that they are protected. And then, of course, we need a plan for what to do when somebody is sick or exposed. Next slide, please. So many agencies have developed guidelines for safe return to work, and you see here Cal/OSHA, public health departments, other government agencies, and these detail industry-specific recommendations like the ones that I mentioned before, but made specific to particular industries. And as everyone knows, I'm sure Cal/OSHA is the agency that has the authority to make conditions.
Hi, pretty girl.
Somebody talking to their child or pet.
Just a reminder, if you can mute yourself if you're not Laura right now.
So Cal/OSHA is this official agency that historically and currently has the authority to regulate working conditions and ensure that workers are protected. And there are actually a number of existing Cal/OSHA regulations that are relevant to COVID-19. In specific, there's a regulation called the Injury and Illness Prevention Program Standard that requires that every employer, no matter what their size, has to have a detailed injury and illness prevention program that lays out how they will identify and address hazards, provide training, and has systems to ensure that workers can report hazards without any fear of reprisal. And Cal/OSHA has directed all employers to develop a specific COVID-19 protection program as part of their IIPP that references industry-specific guidelines that they've issued. There's also an airborne transmissible disease standard, which specifically details required protections for healthcare workers and a few other industries. If you go to covid19.ca.gov, you will see also a recently published handbook for employers developed by the Department of Health. And public health departments and local governments have also issued their own set of guidelines and safety orders. Next slide, please. But I want to talk about some of the challenges in this environment. First of all, there are, as I said, multiple guidelines, and we see guidelines from Cal/OSHA, Government Resiliency Task Force, local cities and counties, public health orders, and it's been very confusing to workers and employers about what guidelines apply. And this is a quote from the Public Health Services Department director in Kern County, which is experiencing some major outbreaks. He says the state has done a poor job of clarifying who is supposed to enforce state mandated restrictions and has sent confusing and sometimes contradictory guidance from multiple agencies responding to the crisis. Next slide, please. And another challenge is there's overlapping jurisdictions. So for example, here is a quote from the mayor in Livingston, who is responding to an outbreak at Foster Farms, where there's been a recent workplace outbreak. And he says, we don't have the authority in Livingston to just walk into Foster Farms. We don't have that. Only Cal/OSHA and the county does. We do not. Next slide, please. Another policy challenge that is kind of informed by the previous one is that there's a lack of enforcement. And we've been hearing from many workers that the recommended safety measures and all of the guidelines that are out there are not in place. So we really need to ask whether and how they're being enforced. So Cal/OSHA has reported that they have received over 3,500, and I think it's now closer to 4,000 Cal/OSHA complaints, but as of yet, they have not issued a single citation. We understand that a few might be in the works, but it's been 5 months and there haven't been any so far. It is also well known that as an agency, it's woefully underfunded and understaffed, limiting its ability to do enforcement. For example, Cal/OSHA has a 20% job vacancy rate and employs just one inspector for every 102,000 workers in the state, leaving the agency dramatically under-equipped to respond to violations related to COVID-19. By comparison, Washington State employs one inspector for every 25,000 workers. And there's also concern that enforcement is more difficult because there's no specific regulation for this pandemic. As a result, a network of advocacy organizations have submitted a petition to the Cal OSHA Standards Board requesting an emergency COVID-19 regulation that would cover all industries. Next slide. So where Cal OSHA is missing, local public health departments and government agencies are stepping into the breach. But for some of these agencies and departments, the focus on an area where Cal OSHA has traditionally had jurisdiction raises specific challenges. What are the systems they follow to do that? How do they enforce? Do they have expertise in the systems used to address worker exposures, including what are the best solutions that can be put in place in a workplace? Are there systems in place to ensure transparency and public access to information about clusters and to ensure worker involvement? For example, Cal OSHA has specific regulations and procedures to ensure that inspectors talk to workers and that workers can remain anonymous and be protected from retaliation. As other agencies step into this arena, do they have those systems in place? And also, we've been hearing that the Department of Public Health also lacks sufficient investigators to conduct proactive enforcement operations. Next slide, please. So to illustrate this point, I just want to read another quote from the mayor of Livingston, who's dealing with Foster Farms outbreak, where he says that officials with the county health department are writing new procedures for how to handle the outbreak as they go. They're literally writing the book as they go along. They said, I know it looks all over the place, but no one has any procedures. There are no guidelines, no books, no manuals on how to deal with this anywhere at the state level. So Merced County Health, who's never had to deal with this either, is trying to find the best way to work with it. Next slide, please. So what do we need? What are we looking for to ensure that there is safe and just return to work? So we need to have effective and stringent health and safety protections informed by guidance and backed by strong enforcement. We need guaranteed sick leave, job protection, and right to recall. That is, people who've been laid off or furloughed, they need to have the right to come back to their jobs when we reopen. And we need inclusion of and respect for meaningful worker and union involvement in all planning, protocols, and decision-making regarding safety in the workplace and return to work. Next slide, please. So I want to talk a little bit more about the importance of worker voice and involvement, because one strategy to enhance information gathering and enforcement is to elevate the role of worker and worker organizations. Workers who can act as the eyes and ears of health agencies dramatically increase the capacity of those agencies to conduct strategic enforcement and ensure compliance in their workplaces. Workers are the experts in the conditions they play and can play a crucial role in promoting public and worker health. But they need to be empowered to speak up and participate without fear of retaliation. We need to recognize that many essential workers are vulnerable. Many low-wage workers are reluctant to call in sick because they need the money and are afraid to report safety violations for fear of being fired. And they have no safety net if they're not working. And if workers are fearful of speaking up, they are less likely to raise complaints or report unsafe conditions to local and state enforcement agencies. And in a recent report by UC Berkeley and UCLA labor centers, they cited strong evidence that worker voice has a positive impact on compliance and that unionized workers, who are often better protected from retaliation, have played critical roles in advocating for needed protections. Next slide, please. So I want to mention a new model that is now being promoted in LA County to harness the power of workers in addressing unsafe working conditions. LA County has recently passed an ordinance that would set up public health councils in each workplace site as a forum for worker participation. The ordinance would also certify local community-based organizations, unions, and worker centers to assist those councils in education and enforcement as a way to expand the capacity of the departments of public health. And LA County is turning to health and safety experts at UC and in the community to help develop implementation guidelines and build the capacity of community-based organizations to participate. This is an exciting model that can serve as a model for other counties around the state. Next slide, please. And I want to close just with a few recommendations specifically related to the critical role of public health departments. So public health departments can play a critical role in increasing coordination and transparency, better improving the sharing of data on workplace clusters with workers and the public. They can collect industry and occupation information on all cases. We need more information about where this is occurring. Departments can ensure prompt contact tracing, testing and paid quarantine, and more resources for enforcement of safe working conditions. And finally, a broad education and outreach campaigns that can elevate stories about what workers are experiencing and do outreach and education about workers' rights and benefits. And it's also important to provide specific training to public health inspectors involved in workplace enforcement, so they have the information they need to be assessing conditions and are also trained on connecting with workers. And I just want to mention that about 8 to 10 years ago, LOHP did a project in collaboration with the San Francisco Department of Public Health and the Contra Costa Department of Public Health, specifically looking at how restaurant inspectors can incorporate into their regular inspections looking at working conditions that are beyond the kinds of things that are usually and typically looked at in those inspections. And we developed tools that they could use to highlight that information. So that's an example of a project that actually is trying to enhance the capacity to use existing public health inspections to look at broader working conditions. Next slide, please. I wanted to thank you for the opportunity to speak to you all today, to say that LOHP and I am happy to continue to collaborate with you as you tackle this really important and challenging situation. Thank you.
Thank you so much, Laura. And I want to ask everyone, if you have questions for Laura, just take a second and jot things down. We're going to hear from Karen next and then group our questions together for both of them. So you'll have kind of both sets of thinking to inform your questions and what you're thinking about. So,
we got free time to play.
So I'm going to turn it over to you, Karen. And again, Karen Relucio, Health Officer, Napa County. Really happy to have you with us, especially amidst all the different things you're juggling.
Hi, everyone. Thank you for the opportunity to talk about farm worker protection. So I just want to start off first by saying that what we're doing in Napa County is we are far from perfect. And I just wanted to just disclose in full transparency that some of the solutions that came out was because of just mistakes that were made along the way. And so I just want to really acknowledge that and that there's a long way to go as well. But I just wanted to start off with talking about how everything started with first with just conversations on expanding testing in Napa County, and where we already started seeing some barriers. So in April, we had some really well-meaning community members that are part of the wine industry that wanted to increase accessibility of testing to farm workers. And as we were having this conversation, I think that a lot of people that are working with farm workers that really understand the health equity impacts of that had raised the fact that, well, it's not so much that we need to make testing more available to them, it's that we need to make the wraparound resources to safely isolate and quarantine them if they test positive, or all these other areas, that has to be addressed first. And I think that in the beginning, when we tried to address that with our wine industry partners, our Farm Workers Foundation and all the advocates, there was just definitely a split in the way that was approached. So our Department of Housing and Homelessness Service, which is in the CEO's office, has a component where we have a person that works with the farm worker housing. So I think what they wanted to do was to just establish more trust with the farm workers. A lot of them, so there are 3 large county farm worker run housing where we contract with the Housing and Community Development to house them. And so they started doing just frequent visits just to, at the time where the farm workers would come for dinner and one of her staff would go out there and just have a conversation about ways that they can protect themselves from COVID-19 and just to establish trust. So that took several visits, and it was just frequent engagement because we knew we were going to run into a time where eventually there was going to be an outbreak. We were starting to see as we were opening up the economy. So we had our attestation in Napa County approved on May 18th, meaning that we would open up more sectors and loosen up the stay-at-home order. And so we were already preparing for that eventuality. In addition, we were working with other, the Farm Bureau. We were working with our Grape Growers Association. Our grape growers tend to be the ones that are the advocates for the farm workers. So they try to, put out messaging and information that can be used by the industry in order to promote physical distancing and hand hygiene and all this other information. And so we were working together with them on that, and as well as just trying to get just educational material out to the vineyard management companies and everyone else. So I think that, so we started, that's where it started. And I think that we started to see some workplace associated outbreaks, which were coming mostly from so a lot of farm workers would come into Napa County and work in a vineyard management company, and they would end up working in a winery. So a lot of what we're seeing were people that were out of county that were actually getting infected, and that's what we were detecting it within the workplace. So the engagement had gone up, and we also had noticed that we started having a lot more cases that were popping up that started going into the farm worker center where we have which are county run. So I wanted to just talk about how this part didn't go so well. So we have 3 large farm worker centers. One is in Calistoga, one is the Mondavi Farm Worker Center, and the third one is River Ranch. So I'm going to start with a tale of three outbreaks. Yes. So in Calistoga, we started seeing a couple of people that were symptomatic, and we had trailers that were brought onto the site in case we should have a symptomatic farm worker so they could be separated from congregate housing, which they're at. So there's 60 people that live in dorm style settings that don't, first of all, they don't have ceiling to floor walls. It's only a partial wall. So then it increases the chances of outbreaks. There's a lot of congregate eating and congregation between farm workers. So when we were starting to see some symptomatic people, they were taken out into the trailers, but they were really afraid to get tested. So testing was offered, but they didn't want to get tested. I think a lot of it was the consequence management of what would happen if someone was detected with COVID-19 is that they would have to be isolated, or else if somebody's exposed to them, they would have to be quarantined. So that was really, we started off with a few that were sick, and then finally what had to happen was that somebody got so sick they got transported to the emergency department in our local hospital. So I think that they got sick, and then more farm workers started getting sick. So at that point, it took more engagement with those farm workers in order for them to finally agree to testing. Testing took place at the farm worker site, and most people, because of the relationship that was established by some of the county staff that had worked with them, they agreed to testing. And we had a bunch of positive tests. So I would say that in total, we started seeing, at first there was 5 positive tests, and then a bunch, and that ended up being like the denominator of 30. So it was like a 50% attack rate. So we wanted to move them into our motels in order to, decongregate them. And then we would do, then the farm worker housing would be deep cleaned. So I issued an isolation and quarantine order, and I can say this is where things went really wrong. One of our employees went out there and they started issuing the isolation and quarantine orders, and then there was a lot of fear with the farm workers. They started, saying, "What's going on? Why can't we go to work?" And then some of them ran away. Some of them actually left for other counties, so there was a flight. Some of them left for San Joaquin County. Some of them left for just other places to be either with family or else to work somewhere else. So this is where, in the middle of this, we're just thinking about, well, this is what's happening. This is going to impact not only other farm workers, but it does impact the industry. So it was just trying to have conversation with the industry about how we need to do things differently, because this was just a really big, this was not going to work. So eventually they were moved into the motels, the ones that are, the ones that stay behind. And then at that point, there was a lot of engagement with Napa Valley Community Foundation, who actually has done a lot in order to protect, farm workers and undocumented immigrants. There was a meeting where they agreed that the one way to actually, make sure that they're able to finish their isolation quarantine period and then what we do is see enough wages in order for them to not feel like they have to go find a job somewhere else. What happens now, we've gone through 2 more outbreaks in farm worker facilities. So Calistoga was our largest one. So they were kept in the hotel until they can finish their isolation period if they're symptomatic, or quarantine period if they've been exposed. And then in the meantime, the farm worker housing would undergo deep cleaning. In the meantime, they were engaged with social services, and, they had food brought to them. If they had family that they're trying to feed, we tried to support the family. So it was just trying to really make it comprehensive wraparound services, along with giving them the incentive of staying in a facility where they can be separated and not, and to break the chain of transmission. So since then, this got really implemented in our second outbreak. So the second outbreak occurred in our Mondavi farm workers housing, and there was less of an outbreak in that situation, but there was a lot of, this got worked out so that they could stay in the motels, and they were taken care of while they were there, and they were paid. And so this is where we decided to approach things differently. So with the second outbreak, instead of isolating and quarantining them, I know that they needed to work. So what we tried to do was just to give guidance on working with face coverings and making sure people are really separated from each other. And we worked with the farm workers management in order to make that happen. And then we were really coordinated in making sure that at the time that I would have to issue another isolation and quarantine order, that we had a place for them to go, and that we would have all of these wraparound services in place. So talk about, this is, I know I was asked to talk about this like it's like a shining, proud moment, but I have to say there's a lot left to go. And I think that, just some things that are outstanding situations that we have is that, first of all, we were able to keep them in quarantine, but at the end of the day, Laura has brought up some stuff that is really prevalent in the industry. For example, test-based clearance. There is definitely evidence with CDC that they're not recommending that anymore. However, the industry is expecting that they do that. So they get retested again, they test positive, and then they have to have a letter to go back to work. And those are areas that, need to be changed, because there's definitely that inequity there. I think that there is still, we're still seeing a difference in the industry interests and the farm worker interests. And the farm workers are really, they're undocumented. They don't have, and they're scared. So I think that part is something that still needs to be worked on. But I'm hoping that with a lot of intelligent minds that I can lean on in my other jurisdictions that have agriculture and in BARHII, that we can get there. So at this point, I'll end there because I have to say it's really nice to talk about this, but I have to say we're far from making it equitable for our workers, and hope that we can just continue to work together to improve that.
Thank you, Karen. And I just want to note, Karen, we asked you not as like a perfect example of having everything right, but as like folks that are in a reflective process of figuring out like how do you really move towards equity in a complicated, messy, dangerous situation. And so, thank you for your leadership and your honesty about like, what's gone well and what are the places that you're adapting and learning. I really appreciate that. And that's actually a lot more helpful than like Napa's figured it out, we're perfect. We want to do just like a quick 5-minute, like very small groups. So groups of 3 to just digest what we just heard from Karen and Napa. And Siobhan will chat questions to your groups, but basically they're just like, what has struck you? And then what questions do you have, or what are you still mulling over from the 2 presentations that you just heard? And then we'll come back together again in literally 5 minutes and just do some Q&A with both speakers. Okay, so go Siobhan, enjoy your small groups, and we will see you in a moment. And now we want to open it up to Q&A with our 2 speakers, with Karen and Laura. So what kind of questions do you have? And if you'd like to ask a question, just go ahead and unmute yourself and ask it. You're also welcome to chat, put things in the chat.
I'll speak up. This is Krista. I've got a question. I know I'm in Monterey County. First time to BARHII, wanted to participate for a long time. So sometimes virtual environments can be very beneficial. And the question I've got is, in our county, California Rural Legal Assistance has been really active with us, and we have a medical legal partnership with them in our FQHC clinic system. And they have a hotline going. So I just was, and that's for legal protections. I'm wondering of the 2, if anything's been going on in Napa with CRLA or just as a partner. And I want others to know they're a really great partner.
Yeah, so we don't, CRLA has not worked with our county, and I'd like for them to do it.
Mm-hmm,
I just have to, just trying to figure out what just navigating. I mean, I have to say I've only been in Napa County for 5 years, and I haven't navigated the whole, the different industries and all the different partners. Mm-hmm. And it's also very political. So yeah. It's, trying to navigate in a way that is, that has been really, challenging. So yeah, we don't have, I first met CRLA during the last CCLHO meeting, and I was like, wow, we need them in our, to be working with us. We don't have any clinics in Napa, so we have a federally qualified health center that is a community-based organization called Ole Health. And so they have a trusting relationship with our farm workers. They're the provider, and they're a trusted resource. But I don't really know what the relationship has been between CRLA and Ole Health, but I don't think we're part of that.
Yeah, and this is Laura, just to chime in. LOHP actually has been partnering with CRLA, which is California Rural Legal Assistance Program, for many years. We have a really strong partnership with them, and we've mainly in the arena of sort of technical assistance and training. So for example, we have been conducting training over the last, well, we've been conducting training as, for farm workers in partnership with CRLA around wildfire smoke, because there's quite a few hazards associated, and there's actually a specific emergency Cal OSHA regulation that mandates protections for farm workers who are working during fires. And so we've been doing training for that community in partnership with CRLA around wildfires. And then just over the last 4 months or so, we've also been partnering with them to do training for farm workers around around COVID. And so I wanted to mention that on our website, which is lohp.berkeley.edu, we do have a coronavirus resource page, and we've just redone our website, and we'll be posting, we have some but not all, but we'll continue to be posting some of the numbers of webinars we've done for workers in Spanish and in English on COVID-19, and I can particularly see if I can get access if people are interested in the ones that we have done with CRLA. So they've been very interested and active in this issue.
Thank you both.
Other questions?
Hi, I have a question for Karen. So to assist the farm workers who may be undocumented, how do you provide them with the financial assistance or support for housing? Because I know for there's some services or opportunities out there, but a lot really aren't for undocumented folks. And so I'm just curious how your department is approaching that, or what relationships you have to assist with that.
Yeah, so we end up, you know, we have a team that very much, when we identify cases and contacts, so we don't normally, engage with farm workers directly in public health, but as through the COVID-19 response, if we have cases or contacts, close contacts of cases, when they're doing a case investigation, they asked about needs that are, is there financial needs? Are there, housing needs? During the course of the interview, that's where we find out that there's resource needs. And so we have another team that tries to connect the person that's being investigated, as a case, to a community-based organization that provides these services, because they're really trusted sources. So we work with family resource centers, depending on where they live. In the city of Napa, which is more in the south part of the county, we work with a couple family resource centers. And then if they're up valley, it's another family resource center, but they all tend to work together. And we also work with our community foundation that provides funding through the family resource centers. So it bypasses the whole government, providing assistance, which is really not a trusted resource. And so that these partnerships are incredibly important. And we really try to, do everything through the CBA as much as possible.
We have time for probably one, maybe two more questions. So let's actually take two in a row and let the speakers respond.
So Will, I have one for Karen. So given that we will experience, other pandemics, and in particular around agricultural workers, where are the advocacy points around improving the living conditions for them, and also, getting that mandated sick leave written in so they don't have to battle these things when they do come up?
Great, and let's hear one more question.
Will, if I have a question for either of the speakers. and that is the, my understanding is a lot of the farm labor contractors actually house their crew in, say, Solano County, and then transport them to work sites in Napa and Sonoma County primarily. And I'm just wondering if either of you have has there been an ability to work with the farm labor contractors trying to, because it's across jurisdictions, and I was just wondering the experience working with that group of workers and contractors.
I can tell you, I haven't had the opportunity to work with them directly, and it's another department within the county that works with them. So I would, you know, yeah, I don't know enough about, you know, about that in order to even to talk to that. I know that there's definitely cross-jurisdictional COVID, you know, a spread of COVID within, you know, in other jurisdictions, mainly because of just the transport and the shared, you know, just trying to communicate about like the protective actions with congregate transportation. I mean, so yeah, I haven't had I don't work directly with them, so I don't feel like I'm really well equipped to answer that question.
Yeah, can I just make one comment about the farm labor contractors, and then I want to be sure Darius's question gets answered also. I want to just mention another resource. We've also, in some of the training and outreach we have done work with farm labor contractors, and would be happy, you know, offline or at a later time to kind of share any of the materials we've developed. And I also want to specifically call out UC Davis, that has an education outreach program kind of like LOHP, and they've done a lot of really great materials for farm workers and farm labor contractors around again, COVID and around wildfire smoke. So I'm happy to try to connect with some of those folks that people are interested in. And then just a quick response to what you asked, Darius, which I think is a really important question. And the one thing that I think has been really, you know, I don't know, silver lining, but this COVID crisis has created many statewide networks of advocacy organizations that have come together representing many, many different communities and industries, including agriculture, to really try to formulate demands about what it takes to address this. And there are little groups that have been looking at things like working conditions, the group that I've been part of, but there's been other groups looking at things like housing and benefits, because as we've heard from what people have said, without those aspects, without money to, you know, a safety net, that people are not going to get tested, I mean, for all of obvious reasons. So I actually feel, you know, a hopeful sign is that there's been way more advocacy. There's been demand letters written that have been forwarded to the governor, just much more political activity, and you know, a lot of people emerging to address those issues. So I think, you know, there are groups advocating, and I hope they'll continue, because I think, as I was saying early on, this has really exacerbated issues that have always been there, but now we can really see their impact.
Great. So unless you have anything to add, Karen, do you have anything to add?
No, I don't have a lot to add. I think that I'm kind of learning from people on this call. So thank you.
And Karen, can I ask you just one more question? In your role in statewide organization with other health officers, is there anything to kind of report back about sort of how this conversation is unfolding across the state?
Well, I know that, you know, in terms of, you know, farm worker protections, or, you know, I mean, just seeing the disproportionate impact of COVID-19 in communities of color. I know that there, you know, we've been, well, first, you know, really trying to address this while trying to address a tremendous workload of which we're hardly keeping up with. But I think that, you know, we started by having CRLA speak at CCLHO. And I know that the state has been, you know, trying to address messaging and essential worker protections, and to, you know, to try to address the health inequity piece of this. And then the other thing is with testing, you know, the way that testing was set up was more like, oh, let's set up a bunch of mass test sites that people that have to drive through in order to, you know, to get tested. And the way that the process is done, it just, it's a scary process for people that are undocumented. And so it's an unmet need. So I think there's shifting that's happening in several directions, but we have a long way to go.
Great, thank you. Okay, well, let's give a hand to both of our speakers. Thank you very much for setting the context. And Siobhan, if you'd pull up the presentation, I'm going to take the next piece, which is really trying to summarize some of the work that Bradley in particular has been driving as a consultant here for us at BARHII. We've been working together to look at, he's been in a series of conversations with worker, immigrant justice, and labor allies about what some of the key demands are. And then I've been talking with health department staff to try to understand more from a health department perspective. And so I'm gonna go through just a quick presentation about kind of where we're at with that thinking, and end with some potential strategies that we could pursue either as individual health departments or at a more of a regional or sub-regional level. And then the majority of the rest of the meeting is going to be in discussion about what we've heard and where we think there's possibilities to really be moving forward some protections that we know we need for the most vulnerable workers. So next slide. So I don't need to remind everyone right now, but we're in a global pandemic with really far-reaching consequences. This data is a bit old, but almost 400,000 cases in California, and I think we're interested in looking at essential workers and the health of essential workers, both because we care about workers' rights, we care about worker safety, and also because if work sites are in fact a key place of driving the spread of the coronavirus, we need to be thinking about them both as places that we protect workers and as places that we can actually stop the spread more broadly and protect all of us. Next slide. And when we dive into the data about who's being affected by COVID, it provides some real, I think, mandates for action about how we can think about essential workers. So, this is data from CDPH Office of Health Equity, and you can look and, you can see the percentage of cases very much disproportionately Latinx. And I think, what we've been hearing, and this I think makes a lot of sense given the state's workforce, is that's because a lot of Latinx workers are essential workers and are also workers that don't have as much power in their workplaces, especially for undocumented folks. So are, therefore exposed to more conditions or more potential risk. I think one other thing to point out is for African Americans, we don't necessarily have a super high percentage of cases, but when you look at the death rate, it's much higher than it should be. I mean, it should be nothing, but like much higher than you would expect relative to the percent of the California population. And I think what we've heard from some preliminary conversations with epidemiologists and health departments and others is that disproportionate rate may be driven by deaths in a couple different settings, in particular long-term care or nursing homes, congregate living, and then also potentially folks that are incarcerated, and both the workers and the people themselves who are incarcerated. So that's, from that look of the data, that kind of carried through in terms of how we're thinking about which sectors and which workers we might want to be focused on. Next slide. And this is just highlighting that same kind of thing where although the disproportionality in cases is really amongst Latinx folks, the high death rates that we're seeing are in Native Hawaiian and Pacific Islander communities, and then Black and African American communities. And that parallels the health disparities that we've seen in general in the Bay Area. Next slide. So when we think about protecting essential workers, so I've been charged at BARHII with thinking very specifically about physical protections. Like, how do we make sure that when you go to your work, you don't come home infected, you're not exposed to risk. But I wanted to situate that within the broader set of policies, and I think both Laura and Karen have spoken to this already, of like, we can't actually just concentrate only on people's physical protections. We need to be thinking about the broader set of supports. So while we can be thinking about, while we do need to think about the physical protections, and today we're really going to focus there, we also need to be thinking about people's mental health. This came up for me yesterday. I was talking to someone up in Sonoma County who was just describing the rounds of trauma that employees are facing and their essential workforce is facing when they're called back in to help residents get through one more trauma of the cycle of COVID and fires and heat and power shutoffs, et cetera. And so be thinking about, we need to be thinking about the mental health of workers. As people already highlighted, we need paid job protected leave. Like, if people don't feel like, and we need it for everyone, right? We need supports for undocumented immigrants and for everyone else, such that if you are potentially sick, you can stay home and still feed your family. Like that is just like a complete baseline if any of the rest of this stuff is going to work. And Asma here at BARHII Rise Together has been championing that work for us. Similarly, we need a broader set of economic rights and supports such that essential workers, who are laid off during the pandemic have a right to be the first people hired back at their jobs, that we have fair scheduling that accommodates our families and schedules and potential medical situations, hazard pay, cash aid to families, especially undocumented people. And then the bulk of my work is around housing stability, and we're seeing a looming cliff of evictions as well, and mostly for essential workers or for people who've been totally laid off. So we need to also be thinking about housing assistance. But within that, again, today we're focused on the first two pieces. Next slide. So this is kind of how we've approached this project. We've looked at the data to try to understand which sectors we want to be prioritizing focus on. Bradley's been leading the work on interviewing worker organizations, and we've thought about that broadly, traditional labor, but also worker centers, immigrant rights organizations, folks like CRLA, et cetera. I've been in conversation with health departments and health officers. We've tried to narrow down to some prioritized sectors, which I'll talk about in a second, highlight identify some promising strategies. And then today we're at the point where we want to make sure we're getting feedback as we actually start moving into action. Next slide. So a couple things to note about the approach. One, like all our work here at BARHII and Rise Together, we want to prioritize racial equity. In this case, the folks that we're seeing elevated cases and death rates for. We want to be looking for double bottom lines of where can we actually improve worker health and population or client health at the same time. So that long-term care sector is a good example where if we can actually reduce the spread and reduce the risks for workers who work in those facilities, we then actually knock out the risks for the people that live there as well. And which seem to be driving kind of some of the highest rates of death in our state. And then also look for opportunities where we can improve worker health and enable other workers to do their jobs. So I think childcare is a good example where a lot of us in the state are trying to figure out, like, how do we actually do our jobs and take care of kids at the same time? And childcare workers are also often very vulnerable workers. So how can we think about strategies that actually hit both of those things at the same time? We've been looking and expecting that strategies will need to include a mix of new policies, education about the guidance that does exist, and then enforcement. And I think as we've dug into it more, it seems like enforcement is really highlighting as the main gap that needs to be filled. as we think about strategies, we're thinking about strategies where we mobilize health officials and the leadership of health officials like Karen, while at the same time partnering with workers and really looking to worker organizations to lead on the political pushes and on clarifying the demands. And as we've thought about kind of this set of factors and the data, we're really narrowing in on 4 prioritized sectors, so agriculture, childcare, and then long-term care or nursing homes, and then jails, prisons, and detention centers. Next slide. So I don't want to get like too lost in the data, but just to like give us some sense of what we're talking about. This is just the number of workers in the Bay Area, and this is from the Bay Area Equity Atlas, work that PolicyLink has been doing. Just the sheer number in different industries. And you can see, you know, construction, I think if we're doing more sectors in the future, just the sheer number of people really indicates some, that we should put some interest there. But childcare, certainly tons of workers, high percentage of folks of color. Same for long-term care. It's very disproportionately Black and Latinx. Same for agriculture. Next slide. You know, and you see similar patterns, although not exactly the same kinds of patterns when we look at immigration status. Again, childcare, agriculture, long-term care, heavily immigrant sectors in terms of the workers. And, you know, especially for undocumented immigrants, therefore, many workers have a lot less power in the workplace and a lot less, you know, Laura was talking about who has the power to kind of stand up and ask for worker protections and who doesn't. And immigration status is one of the key ways to think about that. Next slide. And then, you know, similar kind of dynamics around gender with childcare, domestic work, long-term care, et cetera, being really predominantly female. Next slide. So now I'm going to get into some of the potential strategies that we've been thinking about. And Bradley, by all means, feel free to jump in as well, because he's really been doing a lot of the heavy thinking here on these. But one is an integrated set of strategies around farm worker health. And these all parallel things that Karen and Laura have been bringing up. So the first one is really around doing a really good job with testing and contact tracing and service integration in a way that reflects the fears that people have of testing in terms of like interaction with the government in general, and you know, fears around immigration, and then also just like what happens if I lose my job, right? Like what does a positive test mean if then I can't work? And so thinking about rapid testing led by promotoras, community-based clinics, et cetera, you know, trusted folks in the community, and then backed up by community-based support services, including housing, childcare, food, nutrition, healthcare, cash aid, et cetera. And really making some, doing this collaboratively with growers and philanthropy to try to get the kinds of things that, like in Napa County, where you were actually able to leverage the foundation and growers to help support workers when positive tests did appear. The next piece is around job site safety protocols, so really developing really clear protocols where they don't exist and compiling them where they do. And I think one of the key pieces here is really both focusing on the on-site work, so you know, when people are actually in the fields or packing houses, et cetera, and then the off-site. And you know, I think we started talking about this already in the discussion, but a lot of folks who work in agriculture in the Bay Area, largely in Napa and Sonoma, actually live in Solano County or the Central Valley, or further off where it's less expensive, and where a lot of the contractors house people in those kind of dorm style settings. So, you know, if we're just focused on safety at the workplace, we're going to miss the broader safety considerations of people in you know, getting transported out in school buses or the really packed living situations. And then finally, I think we want to just like discuss the idea of is there some usefulness of cross-county collaboration amongst our heavily agricultural counties? And does any of this get sort of utilities of scale if we talk about and think about strategies together? So that's what we have around farm worker health. Next slide. In terms of childcare providers, there's a couple problems that we're seeing when we're talking to folks in the field. One, a lot of childcare centers have actually closed, and home-based providers have closed. And in a lot of cases, this is—
Hello?
Yes. Someone's sole livelihood. Some are operating at reduced capacity. And then nearly half, in at least one study we've seen, nearly half of the folks say they actually need more guidance and resources to protect themselves and the children in their care. And I think if we're not taking that seriously, then these sites as well could be a site of really furthering community spread. So next slide. So one of the possible solutions here is to convene, and this could be like in one county, multiple counties, depending on how we'd want to approach it, but convene a task force of relevant organizations. So the offices of education, First Fives, county resource and referral agency, the child care providers themselves and their organizations, community college early education programs and UC Berkeley, and really do some thinking together and develop a roadmap for safe reopening, which would include safety protocols and training on those protocols. Siobhan, can you pull back up the presentation? Great, thank you. And then, potentially bulk purchasing of PPE and other supplies. And then also think about, is there a way to actually bring in new, more funding as well? The next piece is something that Laura already mentioned, which is learning from LA, where they're instituting this worker safety council model, where workers form safety councils and are responsible for safety within their organizations, where worker and community organizations train and provide TA and assist with some of the enforcement and documentation tasks, where there's development and distribution of multilingual materials and training, and then development of sector-specific safety protocols, again, where those don't exist, and then compiling them where they do, and then appointing workplace safety compliance officers who implement the guidance. And all of this is then connected up to the public health department, who backs up workers when conditions are not safe. And this is something that we could consider, again, at a regional level or in a county or two, and then either across sectors or for specific sectors like long-term care or jail and prisons. Next slide. And then this one, this has come up in a lot of the conversations that both Bradley and I have had, and in our own work when we were trying to figure out like where are outbreaks actually happening. It's really difficult to tell. Like we actually don't have good data on what kind of workplaces the outbreaks are really happening in a lot, beyond kind of anecdotal data of people's stories or what they're hearing. So some suggestions around here is that we could, at a regional level, convene public health leadership and also epidemiological staff to develop some shared data collection and reporting standards to make sure we really have actually actionable data and can respond in real time to outbreaks as they occur, and pick the right places to be intervening in. So this would look like making sure that people who are collecting data on the confidential morbidity reports are trained and understand the importance of that. It seems like a lot of the forums are actually missing that particular data point. Developing some uniform outbreak reporting standards, so we know when we actually declare an outbreak and how we do that, and then publishing it publicly. Potentially doing some work at the regional level to create a data dashboard. And then at the regional level again, we could develop some communication pieces to really raise the profile of this issue. I think one of the things that public health can contribute to this is really helping to raise the profile of the issue and say, we're really paying attention. And that's something we heard as a priority from some of the worker organizations that we talked to. Next slide. Another piece, and I think this might be our last set of recommendations, is around just enhancing our local health department capacity to do enforcement tasks. And this could look like a lot of different things. One, the sort of high scale thing is the worker safety councils like LA is doing. Laura already mentioned the possibility of enhanced roles for environmental health inspectors. That really only gets us to restaurants, but still, is an important potential opportunity. Other folks have talked about setting up multilingual complaint lines where workers can anonymously send tips, basically, and then the health department follows up in some way. Even as simple sometimes as just sending a letter saying, hey, we've got a tip, we're concerned about workplace safety, or we're interested in workplace safety at your establishment. And what we've heard is that even something like that can sometimes have some effect, at least. And then some of our counties are already starting to fine businesses for non-compliance, and especially larger businesses. And it's something we need to think carefully about with smaller businesses and community-owned businesses, but still something to potentially build upon. And then a theme that we've heard throughout all of this is really a need for multilingual, culturally appropriate public guidance that clarifies what rights workers do have, and making sure that we get those out. And then finally, I forgot where this idea came from, but at least one of our counties is thinking about the idea of procurement standards of, can we actually mandate, with the people that we do business with as public health departments, can we mandate health insurance coverage, a COVID safety plan, and compliance with guidance? So that's it. I want to pause there and get us all into groups, and Siobhan will put us into small groups again and discuss, and she'll chat us the questions. But basically they're like, what's happening in your jurisdiction or the place that you work that we should know about, and we should kind of add to this list of things that are exciting. And then what did you hear today that's most exciting to you, and that you think we should be pursuing either locally or thinking about regionally? And I guess I want to also just note, I've been talking largely about health departments, and I know we're actually like a multi-pronged coalition now, and I think none of these strategies are going to be successful if they're government agency led. And so in your groups, be thinking both about the roles that government agencies can be playing, but also social services, social safety net, and community-based organizations and organizing. Okay, with that, go to your small groups, and then we'll come back for a full group conversation. Hi, everybody, welcome back. So I hope you had good small group conversations. I did hear a couple of people ended up in groups without other people. So I hope you weren't too lonely, but welcome back. So what we want to spend the rest of the meeting on are just a couple of quick questions. Like, one is, what's happening where you work or in your jurisdiction that you think the rest of us should know about in terms of like being able to share models, or like Karen did, share examples of things that are like complicated and hard and we're still working through them. Well, let's start with that question.
Can you repeat the question, Will?
Yeah, what's happening in your jurisdictions or where you work that you think it's worth other people knowing about?
This is Nora in Sonoma. I can share briefly. In our breakout, I was sharing So obviously, farm worker community here hit pretty hard. Part of the department's response has been to stand up a Latinx health work group, and it consists of members of agencies and individuals working directly with families impacted by COVID. And Will, you kind of gave a little bit of a shout out, I think, to Sonoma earlier, but really thinking about how we provide the isolation support. And so part of what came out of that group was the need for kind of a coordinated network across the county that can provide isolation support. And so the group recommended basically a model, and the county, the department established an RFP, and we're in contract negotiations now with some providers who are going to tap into our, hopefully our FRC network to provide isolation support. Part of it will be an outreach and engagement component directly with farm workers. It was something we heard about in Monterey that will bring nurses and doctors into the fields and work with the mayordomos to kind of both, I think that part of the idea is to, with the assumption that many farm workers are probably among the most disconnected from services, to be able to connect with those folks through trusted partners. Many of them are not Spanish speakers. They speak other, or they're not, their first language is not Spanish, it's other indigenous languages. And so providing indigenous language support. I think what's most exciting about it that I was sharing in the breakout is that, the model really bubbled up from this group, and our director and our board of supervisors, in a way that I have never seen before, has empowered this group to make the recommendation and put up some serious money to fund the program. So I'm excited about it. I think it's a model that of kind of racial equity and power sharing that I haven't seen operationalized. We've talked about it a lot. So I'm excited to see where it goes. I think we have the benefit of the other primary staff member on the group was also just named our interim, the interim director of our new Office of Equity. So there are a lot of things at play here, I think, making it successful. But I'm excited about it. It feels like it's what the community identified, and the county and the department have just been able to say, great, let's do it, and kind of stood out of the way until we're in contract negotiations, and now we're definitely in the way again, but we'll see how it goes.
That's great, Nora. And we did talk to Alegria as part of the shaping some of these recommendations. So your new equity officer. And I think one of the things we've been talking about as a team also is how do equity officers in general during disasters and during this disaster, what role can they play in helping to advance this type of recommendation across counties? So I'm glad you brought that up. Anyone else want to share exciting opportunities from their jurisdiction? Okay, well, I'll keep that question open, but also move to the next one, which is what kinds of enforcement strategies did you hear about today that you think were exciting, or you think could actually work in the place or organization that you work? I think if we have a real gap in enforcement, what are the roles that your health departments, us at a regional level, and or the community organizations that make up Rise Together could play?
We talk right after this comment. I'm happy to share. So this is Sharon Vicaria from the Marin Community Foundation, and Marin County has established a local sort of strike team that my understanding is also working with the state strike team. And I believe, one of the concerns and questions was really around equitable enforcement and making sure that, equity is really centered in those enforcement practices. And I'm not sure to what degree. I think Change Labs had produced some guidance around equitable enforcement at one point. I'm not sure if that's current or if that's an area where BARHII could be helpful in terms of thinking about, how to conduct, whether it's compliance checks or enforcement actions in a way that doesn't disproportionately impact businesses owned by people of color, smaller businesses that may have access to less resources in terms of understanding state guidance, et cetera, et cetera. So tools around kind of equitable enforcement practices for those strike teams, whether it's coming out of environmental health or code enforcement or some of the other activated parts of city or county government that are taking on this enforcement and compliance role.
Other thoughts? What else did you talk about in your groups?
I think that equitable enforcement piece is key. So we've heard that now from we've been doing conversations with cultural chambers of commerce, and this question of how to help relatively small businesses, particularly people of color owned small businesses, figure out how to work with their communities and their employees around protections, I think is going to be really helpful. We've heard that also from small business majority.
Are there any particular insights that you've been able to glean from that, Melissa and Sharon?
Yeah, that the guidance feels confusing for folks, that it feels hard to understand, and that people need some advice on how to implement things quickly. I think we've heard from the cultural chambers of commerce that that there may be some financial needs related to that piece, but they're not sure because they feel like most of the conversations they've had have been about people trying to understand what's going to be safest for their employees.
Yeah, I think the
other thing we heard, and so some of these conversations are a month old, but the other thing we've heard, this is when things were reopening, is questions around trying to understand quickly how to reopen, and I think pacing was a hard thing for people to wrap their mind around and figure out what to do.
Yeah, this is Sharon. I'd agree with what Melissa said in terms of what we've heard. I would say the other in Marin is just having enough code enforcement, environmental health staff who are cultural, who are trusted, have language capacity, et cetera, to not only build the relationships necessary with these businesses, but to be able to provide, kind of that technical guidance in a way that is accessible. So just it's a workforce issue in terms of who's in our public agencies and their ability to establish trusting relationships with businesses that may not be very afraid of the fact that the government is coming to kind of check on their work.
So just because people have been a little bit quiet, I'm gonna call on people I know and I know are thinking about this stuff. So like Deborah, Curtis, folks from Alameda, Vanessa, and Santa Clara. What are you all thinking about?
I realize from this discussion, we aren't very connected to the public health department. We're a CBO that serves the immigrant and refugee community. So there's a parallel, especially with our day labor program. We were trying to collaborate with the community around using one of our sites for testing, but in the end, with the state, they ended up moving it to another county site, also in Concord's Monument Corridor. I think the issue for me is that there is such a strong lack of data in knowing what sectors are impacted. A lot of our community members are the ones who have been able to get back to work are often, you know, essential workers. They're working for DoorDash, they're delivering food and are working in grocery stores. And then our day laborers, the jobs have really dropped for them, but we are about ready to embark on outreach to street laborers that aren't part of our program, both in Concord and Antioch. Because around worker safety in particular, that's the you know, the content of the outreach. It's a program we're working on with the National Day Labor Organizing Network. It's a lot of similarities, but different in that it isn't a population that has seen the outbreaks that farm workers and folks in rural communities have seen. At the same time, we know in Contra Costa that over 40% of cases, COVID cases, are in the Latinx community. It's the largest population, but we don't know where. They do data by city, but they actually don't say where. So I think we have some work that we need to do to sort of partner with the county on that. And a couple other notes. Yeah, and there's really no guarantee for undocumented workers. I mean, they get a job or they don't get a job. There is no support in the county for anyone who is undocumented who gets diagnosed. And I was telling Melissa in our breakout that we will hear about it only if the person or their family has applied to our relief fund. That's the only way we know, is if they self-disclose that there's someone in the family that has COVID-19.
Mm-hmm.
Yeah, this question of data we've heard a few times now, particularly of can we use the contact tracing data to think more about what strategies people might need and what supports and what industries we should focus on. We've been hearing that and trying to think about that.
You know, it's also this culturally appropriate way of reaching out to folks. So we felt like there would be a higher rate of testing if we did it at our monument site, as opposed to another site that no one knows anything about. There's such high level of fear. There's, you know, there is in the news that there's more ICE activity starting up again. So I think how the county is dealing with that, I'd like more concrete data, because I don't think they're testing very many folks in the monument.
This is Laura from LOHP, and I just wanted to mention one thing that people are probably aware of, and I think maybe I've discussed this with Melissa and Will, but there is about to be, in a couple of weeks, in mid-November, a big push to do testing in Oakland in partnership with La Clinica in the Fruitvale area. And there's a team of UC researchers at UC Berkeley and UCSF who are trying to take that opportunity to develop some surveys to be reaching out to the people who are coming in for testing. That includes questions about workplace and occupation, and to try to begin to gather that data. And so that's just one model about using those kinds of testing programs as a way to deal with this data gap. And they're in the process right now of developing the questionnaires, and I'm part of a little part of that team, and happy to share more information about that if anybody's interested.
Yeah, I think that's, and they have a strategy where they're creating some anonymity around the workplace pieces to get good data. They're also doing more than has been done around testing with children and young people. And so there's going to be, I think, some interesting information coming out of the Fruitvale shortly.
We just have a couple more minutes left, and I would love to get any more guidance that people have about what's going to be helpful, especially at the regional or sub-regional level from BARHII and Rise Together. Like, did any of those strategies seem good? Were you concerned about any of them? Like, where should we go next?
This is Karen. I just wanted to talk about some of the challenges with the data pieces. So, you know, like, you know, our epi capacity is the same as it was pre-COVID, and we're dealing with a lot, you know, with as our cases have really escalated. The ability to get good data collected, like from case investigations, becomes more limited. There's a lot more errors. And, you know, and basically having the same epi staff that are just trying to update case counts and to deal with some of the, you know, our systems that we use. It's hard to collect that data when you don't have the capacity. So are we ever going to get to a place where we're in, you know, like in Los Angeles, where they're able to actually count like every workplace and to publicize it? I mean, I don't see us getting there in Napa County, and we just won't get the support for more epidemiologists. We could probably get one hired through, you know, the PPP funding that's going to go through our ELC capacity, but that's eventually going to, you know, that's going to be temporary and not sustainable. So those are just some situations where, and then I think just in terms of enforcement, you know, just there. The thing, if I were queen, I would like to see a lot more enforcement, but there are decisions that are made that are at, you know, county executive level, or even, you know, the board of supervisors level, where that is not being supported to the way that I would have loved it to be. So it's just really, it's challenging to, you know, I think just a lot of us are just trying to, you know, figure out how to you know, to stay employed or stay alive. And so not to sound like a wet blanket, but I mean, it's the workload is just untenable, and
yeah,
it's almost like we need help in that area. If it's, you know, for us to do more without resources, it just seems overwhelming.
Mm-hmm.
I think some of the things that Karen is talking about speaks to the importance of regionalization, and the presentations today will, you know, when you went through your slides and you highlighted different practices, it helps us understand, like, structurally why a regional approach amongst local health departments makes sense, and a collaboration, you know, between community-based organizations. Just from right now, just hearing from Deborah and Contra Costick and Shirin from Marin County, like, those things typically don't happen in any organized way. And, you know, and they don't happen, it's difficult for that to happen in any state health department, particularly a state health department that has to coordinate with 61 independent local health jurisdictions. So most of their time at CDPH is partnering with the governor's office, working on their huge outdated infrastructure and coordinating with us. And, you know, in our small group discussion, this is what Solange was talking about as well too. It's just like, you know, like, where is the role of regionalization? You know, in my opinion, like, if you could somehow, like, at the very least forward or clean up some of your slides or put them in like several documents like you've done already, have some of our logos on it so there's some consensus about like what we're saying. Because I mean, just, you know, if we could all look at data from the 3 studies that were highlighted, some of the resources that UC Berkeley and Laura has, like hearing that like Karen Relucio and Napa County, you know, decided not to quarantine undocumented workers, like you highlighting, you know, this like 3 counties of Sonoma, Napa, and Solano, and then hearing from Krista Handy in Monterey, and Gail Newell was on from Santa Cruz. Like, I just want to say I really appreciate it. And, you know, as a deputy health officer, you know, like we typically don't have the time in our local health departments to hear all these like best practices. And I don't think my colleagues at the state, you know, enjoy this luxury to be able to, you know, hear from community leaders with boots on the ground. So although we're structurally many small local health departments, we're lucky that we benefit in being in the Bay Area, that we generally share some common values, or we try to. So I just want to say I appreciate this conversation today, and you know, I think we are BARHII structured to actually make an impact for the rest of the state.
Thank you, Curtis. And Curtis was one of the early folks we talked to for direction on this project also. So thanks for all your thinking on it. I think we need to end there time-wise on this section. So I want to thank you all. As I noted, we're going to be doing some more conversation amongst staff in the next little bit, and producing some, like, here's where we're going to go in collaboration with you all. The only other thing I would note is we're in collaboration with NACCHO putting on a webinar on this topic that's national in scope with a health officer focus on September 2nd from 10 until noon. And we'll be sending out information about that soon and hope you tune in. Melissa, over to you.
Yeah, so thank you. And thank you, Curtis, for your comments. So there are a couple of things coming up and then an invitation for you all who want to carry it forward in your counties. So there's the NACCHO webinar that we've been working on. That's the national webinar that Will just mentioned. That's designed for public health officers and others to have an opportunity to hear what's happening nationally, particularly around the industries that we've heard nationally are most impacted on this, and what workforce protection preparation is being provided to businesses and what enforcement. The second thing is we have been working statewide with our partner in the Public Health Alliance of Southern California and with the Central Valley group to talk about raising awareness of the importance of protection for essential workers around Labor Day. And so we're submitting coordinated op-eds to a number of newspapers to really raise up the importance of protection for essential workers and how protection for essential workers can lay the groundwork for us knowing how to protect more and more workers as people are back in the workplace, so that people can enter into the workplace safely. And then the last piece is, you know, one of the drivers for us to come to this issue is how much it is clearly a racial equity issue. And so we have seen the racial disparities in the COVID-19 data. We see the overrepresentation of people of color in the essential worker data. And we really want to think about how that's part of a process of reducing disparate impact of COVID-19. And so we really welcome people who are in their counties thinking about this, trying to find solutions, to give a call to Will and to let us know, Will or myself, and to let us know what can be most helpful to moving situations forward in your county. To give you a sense of the kinds of things we do for folks, we offered that same offer after Defund the Police, and then we supported the folks who contacted us to understand who else in their community was also working on that issue, and sometimes facilitated conversations, sometimes facilitated introductions. We provided information about what's happening nationally in those areas for folks who requested it, and now we're providing survey and other support for some groups who are moving things forward. And so there are a lot of really practical actions we can take to support your efforts in those areas, and we're happy to do it and here to do it. And so please do let us know what's helpful to you. So our closing is, thank you, Siobhan, for the reminder. We have a poll and we use them. That's how we figure out how to run our next Third Friday event. So if you could please answer the poll that is showing up now on your screen, that would be great. And I just want to thank you again for all the work you all are doing, for how much you care about what's happening to the community right now, and how much energy, effort, and love you're putting into your work at this moment. So thank you so much for your time. Thank you, Will and Bradley, for the incredible work to get us a baseline of understanding of what's happening in this very fluid time. And to Karen and Laura for taking time out to really help us as a region figure out what some solutions are. And we appreciate all of you, and we want to be in support of doing what's best for equity right now. So thank you all. I see the poll is on my screen, so it's probably on yours too. And have a great day.